All right, so guys, here's my talk at the table. It's about worker burnout and fatigue during the pandemic. So last month, the jobs website Monster found 69% of employees reported burnout while working from home during the pandemic. That is up 35% from May. This comes as the national unemployment rate fell to 10.2% in July, which is still historically high. Psychiatrist Dr. Sue Varma joins us now to talk about the challenges and how to stop the stigma surrounding mental health. Sue, it's so good to see you. Thank you so much for joining us. Let me ask you right off the bat, what is burnout? What is work burnout, and why do people feel more vulnerable now?
So burnout is this unique combination of feeling exhausted from your job, having low energy, having a negative mood or feeling cynical about it, and not really feeling as if you have efficacy or agency or that your work matters anymore. And as you said, 2/3 of people are feeling this right now, and we're seeing that this is even more so in the pandemic for a variety of reasons. We're not used to working from home for this long. And let me say that there are some countries, in Sweden, they say that 30% of people work remotely, and that's the norm and that's the baseline. And trust me, there's some people who thrive. But I have a lot of folks telling me that this is long and that they're missing the human connection that they would normally get.
So what causes burnout? I sometimes get the sense that the ground beneath me is uneven, like I'm sort of walking on quicksand or on a muddy ground. Like the ground is always shifting. Is that a way to, that's how I feel. So what causes that feeling?
Yes. So sometimes it's a feeling of that there's more work coming in than you can handle. I know that there are a lot of people who are experiencing a variety of family pressures, whether it be if you're at home and you're taking care of a family and you're managing remote learning, or maybe you're managing somebody who's been sick in your family, when what's being thrown at you is more than you can handle. And that's really what the definition when we talk about workplace burnout. And, I want to say that this is a condition. It's not necessarily a disorder. It was recognized by the World Health Organization earlier this year. And what we're seeing is that it is unmanageable or a stress that's not managed properly. So stress is normal. We're all going to experience days where, we feel like we're burning the candle on both edges, but there's something about the quality that we're not able to live up to or meet the demands. And a lot of times this happens because our bosses or employers, they don't know what we're contending with at home. They're not aware or maybe not sensitive to the personal life aspect, and we're not making time for ourselves and taking breaks. So all of this, the external pressures at work and then the personal demands, there's not a balance, and there's an overflow in the system, if you will.
We've talked about this before, Sue, I think, where, I told you once that what I try to do when I'm feeling stressed is I think about the places that I've been as a reporter where I've seen people who are really struggling with their situation, who've lived through insurmountable tragedies. And I think about people who lived through Jim Crow or the Great Depression, and I try to put my life in context to that. But I don't know if that's always the right thing to do, to look at somebody else or another situation and say, well, it's not as bad as that.
Yes, and it's a good point, because for some people, and I'm glad that that works for you, and I think it does for some people, but for other people, they say, well, you know what, it feels invalidating or it feels minimizing. I know that, if I complain to my husband, he'll be like, but you know what, look at all these other positive things. And sometimes what we need in that moment is really someone to validate us, to empathize, and to reassure us, and to be able to have a conversation. And that conversation often should be with people that we work with, to say, listen, this is what I have on my plate. Is there any way that we can redistribute this? I'm going through a hard time right now. I think it's hard for people to say. People want to show up, and especially in this pandemic when we don't have the daily check-ins. I mean, there were so many built-in things that you could just turn to a coworker and say, hey, how would you manage this? Now it requires a phone call or a meeting. And so what I'm hearing is people saying that what they're missing with the remote working is, number one, the connections and the micro connections that were built in, the water cooler conversations that you didn't have to make an effort, or slacking someone on a work computer system and really having an easy dialogue. And they're missing, what's also interesting, Vlad, is the commute. Now, I don't think anyone in a million years would tell you, oh, I miss being on the train. But we're finding that studies are showing that being on the train or having some sort of a commute, even if you're walking or biking to work was allowed you emotional processing time. It was allowing you to get ready for your day, and then it was allowing you to decompress. So you had these natural transitions. We're finding that people are working on average an hour and a half to 2 hours longer. I know I was up on my computer late last night, and people are sending you emails, and we don't have the same sort of boundaries because our workday doesn't have a finite ending the way it used to.
That's a great point. Dr. Sue Varma, thank you. I encourage our viewers to check out your Instagram, your social media. You always have words of wisdom there. Thank you very much, Sue. We appreciate it.